Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm your host, Ashley Meservey. It's Medical Monday with East Cooper Medical Center, but this time around, we're visiting our friends at the Mount Pleasant Tennis Complex to learn how one Lowcountry physical therapist is using a number of methods to keep players of all ages in the game and out of the doctor's office.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Beth Maynor. She is a physical therapist at East Cooper Medical Center. Thanks for coming out today.
Thank you for having me, Ashley.
Okay, so today we're talking about training errors. What are some of the most common training errors?
Yes, the most common training error is playing too much.
Okay.
Back-to-back days, not giving your body a chance to recover is so important in preventing overuse injuries. And I see that with young kids, I see that with older people. It's just across the board overtraining.
One of the things I've always, when I was back in the day, somewhat athletic, stretching, how important that can be.
Yes, that's a great point. A lot of times, that's the second biggest error, is to come out and just start hitting. We train people to do a dynamic warm-up, which gets their body ready for the activity. And then after you play, we teach people a static stretching program. And it's very important that you do the dynamic warm-up before and the static stretching after to prevent injury.
Because I can't even touch my toes, I'm gonna be honest with you.
Right. So you could come in and we could help
I'm like,
out.
get all ready, because I need to go back out and start playing tennis.
Because most people you see just come out on the court and start hitting.
Exactly.
And that's dangerous.
So what are some of the things, if they don't stretch, that you're gonna see? I mean, pulled muscles, all kind of stuff, right?
A big muscle imbalance. Pulled muscles, the muscles aren't ready to generate the power they need. They're not warmed up, so we see that a lot.
What are, as far as when people come and see you, how do you assess them? How do you find out what the problem is?
Well, that's the great thing about a physical therapist. You don't just send somebody to a computer and do strength training, because it's very specific strength training to rebalance the body, to not be predisposed to injury. So they come in, we would look at an individual, spend a lot of time, the whole first session, on assessing this.
Okay.
And so your individual needs would dictate the treatment.
Okay, so does it differ between men and women, or ages or anything like that? Or is that one thing
that is something that, you know, in every individual, actually, it differs. So we don't just have a generic way of giving treatment. We look at the individual and how they're made, how loose their joints are, how tight their joints are, where they may have overtrained in the past and created a postural change that we can affect.
Well, I'm sure my mom's watching right now, and she'd be like, tell her to stand up straight. So what are some of the tips you have? You've been playing tennis for a long time, passionate about it. So what are some of the things you tell people at home to keep in mind when, let's say, they're either coming out here for the first time or they're avid tennis players?
Well, a lot of times we'll look at their technique and I'll definitely have them get with a professional, a tennis professional. We can do some in the clinic, but we also recommend learning correctly, learning the sport correctly. That helps prevent a lot of injuries that we would see. So and then if they see, if they come into the clinic, we have all of our therapists can help them get an individualized program to do daily.
And obviously communication is key, so they really need to probably pay attention to their body, correct?
Absolutely. If you're hurting, that's a great point. A lot of people think they can push through and it will get better. And that may have been okay when we were a teenager or in our 20s, but if you try to push through, it will only make things worse and can really lead to a more serious injury. So please stop your sport for 2 weeks. I always say 2 weeks.
2 weeks.
And then if you're still hurting, please seek help, because it can get better. But if you push through, it tends to get worse.
Because let's be honest, I mean, your body's changing. I remember things I could do in my 20s and now in my 30s, I'm like, that ain't happening, right?
Right, absolutely.
All right, well, thanks, Beth, so much for your time. For more information, go to eastcoopermedctr.com.